Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University with joint faculty membership at Ross University School of Medicine. And this month actually happens to be Breast Cancer Awareness Month. And so I wanted to talk a bit about breast cancer and the self-exam that is important in diagnosing breast exam. As practice, what I had done along with other medical students is take a look at and feel the breast of a dummy, of a cadaver, um, and be able to diagnose um, some of the disease. I'm gonna show you some visuals that may help. So this is the breast self-exam, and you start around the nipple and then um, go in columns, and then you move outward, and the fingers are specifically used from inside to outside. Um, but the idea is to be able to feel for concrete sort of nodules. So on the inside, you have the ducts, and the outside you have the lobules. And so ductal carcinoma in situ, you might have heard of that, is in fact on the inside of the duct. And then for the lobes, the lobules, you have different cancers. Looking at the types of surgery that are possible. So resection is one possibility of getting rid of the tumor. So that's that right there is a tumor and can be resected. On the other hand, there may be a need for total mastectomy, and total mastectomy is in fact the removal of the whole breast, and many times there's a need for breast not only removal but regeneration. So breasts are too dense when women are young, necessitating a better awareness of this cancer. So typically breast cancer does not originate until about in the 50s, but there is a possibility that breast cancer may occur at earlier ages. And so it's important to not only think about this and understand this, but also be aware that breast cancer may affect pain and impact pain within the breast, but that happens to be more so as an impact of the menstruation. So a lot of times during Mittelschmerz, or the focus on the pain with the menstruation, this is important. So taking a look at changes in the breast that are pertaining to breast cancer, changes in skin feature may occur. See the skin feature. Nipple discharge, that's another sign, of course, if you're not a lactating mother. Then there's one thing called dimpling, and so there's actually recessions within the breast. Lymph node changes, so there's a lot of lymph nodes. Of course, not all of them are breast cancer, but it's good to check. You might have breast or nipple pain. Again, this is something that is commonly experienced in individuals who are menstruating, but if you commonly don't see this and all of a sudden appears, then that is of concern. Then you have retracted or inverted nipple, which is of concern. Changes in skin color. You might have swelling and different types of cancer. Finally, in this slide, what I want to do is end with it's a leading cause of death from cancers among women, and that doesn't change whether it's white, black, Native Americans, Hispanic population. The breast has to be less dense to have a more conclusive result. Breast cancers are more often epithelial tumors involving the ducts or the lobules, and I showed you where the ducts are and the lobules are. Most patients present with an asymptomatic mass discovered during exam or screening mammography. Another more recent breast cancer context is Brca1, Brca2. And the diagnosis is confirmed by biopsy. Treatment usually includes either surgical exclusion, total mastectomy is used sometimes, often with radiation therapy and with or without adjuvant chemotherapy, endocrine therapy, or both. So HER2 new receptors are in fact present in certain breast cancer. And when you don't have these receptors, it's actually more dangerous. You also have receptors that respond to some of the cholesterol-derived hormones.